Hello and welcome to episode 59 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program, and today's topic is PI mills, personal injury mills. This is going to protect you and potentially save you a ton of time and a ton of risk by making you aware of this topic. This is a serious topic in healthcare that involves you being extremely taken advantage of. Extremely taken advantage of by attorneys, by healthcare clinics. This is extremely important to know. If you missed the last episode, episode 58, we discussed wearing a back brace. Is wearing a back brace effective? Should you wear it? Should you not? We discussed all things related. If you have not joined my private Facebook group, it is called RehabFix Low Back Program. Go join it. I post exclusive content in there and I interact one-on-one with you, and I'm answering everybody's individualized questions and providing a lot of things that I am not sharing anywhere else. The link to that will be in the show notes as well. So today's topic is really just a PSA, okay? Because this is a huge problem in healthcare, these PI mills. And it's really, really frustrating what happens here. This is a situation where attorneys are acting like doctors and doctors are acting like criminals. Most of the time, all right? Not all the time. Everything I say is directed towards the majority, not all the time, but most of the time, especially out here in Florida, okay? So here's a situation. You get in a car wreck. Okay, you're in a car wreck. Oh man, you should probably, go to the hospital, talk to an attorney. Attorney gets involved. Boom. Guess what they see? They see an opportunity to rack up a case and to use you and to use your body to get a huge settlement. So you've been rear-ended. It's the other person's fault. Okay, an attorney contacts you. Maybe 10 attorneys contact you. This happens sometimes. Hey, you deserve a huge settlement, blah, blah, blah. We need to get you checked out, make sure everything's okay. Let's go through the whole gamut. So they send you somewhere. They send you to a clinic who they are partnered with. And this clinic knows what to do. Okay, they know that they're trying to gather a huge settlement because you're not paying anything. This is all going into a settlement, right? So you're not paying anything out of pocket. So you're like, yeah, okay. All right, I'll do it. So you go to a clinic. First thing they do, oh my gosh, let's get an MRI. We need to get an MRI. You order an MRI. It might say tons of normal asymptomatic findings. Normal asymptomatic findings, right? Like 40% of individuals 30 plus have disc bulge on their MRI. No problem. 50% of individuals 40 plus have disc bulge on their MRI. No problem. But if you get an MRI after you have a car wreck, all of a sudden those disc bulges are life-threatening. All of a sudden, oh my gosh, look at this, look at this, look at this. You have these disc bulges, you have herniation, you might need surgery, we need regenerative therapy, we need injections, we need a 32-visit treatment plan at this PT clinic or chiro clinic, and you need decompression, and they're just maxing out all of your medical bills as much as possible to build a case, because the bigger the case, the bigger the settlement, more money the attorney makes, more money the doctors make. They're telling you the more money you make. But let's think about what the goal is there. Okay. I have spoken with multiple people who've been in these situations, and it's actually quite sad, who've basically been convinced that their life is over, right? That, hey, it's so bad, this car wreck, oh my gosh, we can't believe you're walking right now. You could have been paralyzed, look at your neck, oh my gosh, this and that. One, they're just catastrophized beyond belief. The fear of God is in them because of what these doctors are telling them, who know it's a PI case, and they know if they can get you to attend as much treatment as possible, they're going to make a ton of money. Okay. And the attorney is going to make a ton of money. And the more they do that, the more referrals they get from that attorney, the more referrals they get from the attorney, the more money they make, the more money the attorney makes. That's the game. Okay. And so first off, you're convinced your life's over. All right. And then you're taking a bunch of time away from your life, a bunch of time away from work because you're going to all these treatments. So If you're just being convinced to do a ton of conservative therapies, all right, there's worse things that can happen. But that usually doesn't stop there. I'll talk to a lot of people who are typically pushed from their attorney, not from the doctor, from the attorney. Hey, you have this, I really think you should go get injections. You should go get an injection. And guess what they do? Any disc bulge they see on that MRI, they're going to do an injection at each one or even both sides of each one, because they're trying to max bill the insurance. They're trying to max bill it to build a case. So I know of multiple individuals who this is the exact situation that happened to them. All right. They were going to a PT and chiro clinic like 4 times a week, getting the most expensive things there. They were there for a full hour, just doing everything there. And then they were being sent out for injections. They had like 6 injections at once on each side of 3 different discs. Okay. One of them was told that he needed to get a nerve ablation in his neck. He had extremely bad side effects. Felt like he had a cape of fire going down his back for 3 months after that. And he was told to do all these things by his attorney. Pushed to do it by his attorney. Not his doctor, not a friend, his attorney, telling him to go get medical procedures. Now, don't hear what I'm not saying. Okay, I'm not saying attorneys are bad. Everything I say is towards generalized situations that happen too frequently, right? In this particular situation, this happens. That's a bad attorney. That's a bad person. These are bad doctors. These are people who are using your body to rack up a bill. How many times can we get you in the clinic? How many procedures can we do? All right, let's do some injections. All right, now let's do some nerve ablations. Okay, now let's do some regenerative therapies. Okay, now let's do chiropractic, and now let's do PT, and now let's do massage, and now let's do acupuncture, and it just goes and goes and goes and goes and goes. Because you're being convinced that something's wrong with you. You're being convinced that you should be in pain. You're being convinced that your MRIs are terrible, like just a disaster happened. You're being convinced to do all these things. And meanwhile, doctors and the attorneys are sitting back going, cha-ching, cha-ching, cha-ching. This could screw your psyche and it could screw your body for life. All right, this is a serious topic because lives are ruined from this practice. That's the truth. Lives are literally ruined from this. People are convinced because as soon as the settlement's over, doctors and attorney, heck yeah, huge check, go on with their lives. Guess what? You don't go on with your life. You're convinced, but wait, I'm broken. I can't do this. I can't do that. I got all these problems. I need to keep seeing a chiro. I need to keep seeing a PT. I need to keep getting injections. Things are wrong with me. You're scarred from that. That's what creates chronic pain or experiences like these. So the point of this podcast is to make you aware for your friends, for your family, for yourself. Avoid these situations at all costs because it could change the trajectory of your future. Regardless of getting money out of the situation, screw it. If you're starting to feel like this is happening to you, stop it. Get out of the case. Who cares about the money? Okay? Assess your situation. Go find someone who cares, who's not in it for the money, who's going to give you your honest opinion. If it's me, great. I've had multiple people come to me after car wrecks who are like, hey, I don't want to get involved with this PI stuff. Or some people from workers' comp. I get a lot of workers' comp people like, hey, I'm being told that I have to do this. I have to do that. It's just a bunch of nonsense. Like, I got to get out of that. I don't care about getting money paid for, care paid for. I don't care about getting money back from it. I just want it out of that mess. I just want pain relief and I don't want to be in this system. It's exhausting. It's not good for you. Okay. It's good for other people. It's not good for you. So be aware of these situations, protect yourself, protect your family, protect anyone you care about from these situations. Invest in a person, invest in a program that's going to teach you how to get yourself out of pain, that's going to give you education, that's going to give you exercise. It isn't just going to try to rack up a huge bill from passive therapies and injections and other things. And if you know anyone in this situation, send them our way. Send them this video. Let us know how we can help. We would love to help you or anyone you know get out of these situations and get on the right plan so that you can learn how to fix yourself, your disc herniation, sciatic related issues in a fast, effective manner in a way that's going to set you up for your future so you can maintain the results long term. And if you're watching on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review. If you have not joined my private Facebook group, RehabFix Low Back Program, go join. Go join right now to get the extra content and interact one-on-one with me. You can also visit the link in the show notes. And as always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.